Good morning, everyone. I'll be speaking on a topic of why to join a medical college, which gives you a best satisfaction. So I have no financial interest in this presentation. So when you are coming out fresh and you are in a big place where there is a changing scenario and ophthalmology is rapidly growing, and with that technology and practice pattern changing, your lifestyle is changing, the patients are quite demanding. So you have a lot of choice. You're in a maze. You have 1, 2, 3 options with you, but always think which is best option for you. So for me, if you are joining a medical college, what I want you to understand is you have to be a teacher. So who is a medical teacher? If you ask some of your students or you ask yourself, I became an ophthalmologist or I became a urologist because I was taught well by great teachers. Well, you influence the students to choose their career. And if you see, this is a quote by Ernest Leary, who said, a poor surgeon hurts one person at a time, but a poor teacher hurts 132. So good knowledge, you should have a very good knowledge, you should be clinically competent, surgically competent, but along with that, you have to have a good communication, you have to have a stimulating and encouraging environment. That is how you are going to produce good quality doctors or ophthalmologists. So if you look at this role model who is a teacher, he has 12 roles to play. He's just not a facilitator and a mentor. He is not only a curriculum developer, so teaching expertise. Even at a student who is at distance, you can become a mentor. You are a guide and you have a lot of role to play in their shaping. So if you ask anyone, all clinicians enjoy the role to teach. You ask each of you, yes, I feel like teaching someone other than just me, myself also. So for that, it can be something difficult, it can be easy, but it all depends on your attitude, skills, and knowledge. And you should have the soft qualities also, being very motivational and having a lot of patience. So who is the role of a clinical educator? I'm not going into detail, but you have this which you can develop. Like you can teach your undergraduates, your postgraduates, give them what is, look into them, look at the feedbacks and actually monitor them of not just giving knowledge, but as an educator. Well, this is a field, if you are in a medical college, you have two types. You are joining a state medical college or you are joining a institute of national importance. Yes, more or less it's the same pattern is there, but how you work out. Research is something you can do. Starting from a case series or writing a case series, you can go into doing a randomized clinical trial, a meta-analysis. You have all types of clinical research trials to go, and in different phases, you can document, analyze, and then publish. So sometimes what happens, you just do a research or a thesis and leave it there. But you can go ahead and do the publications. You have a lot of facilities with you, a very good internet, you have libraries, you have support staffs, you can get a lot of research grants and patents if you are good enough in that. And with that, you get recognition. Well, third point is your clinical practice. Well, a lot of you are ophthalmologists anyway, you will be seeing your patient. But what is the advantage in being a medical college? You have a multidisciplinary approach. Today, the patient is coming with a proptosis, and you think that it has come out because you have a neurosurgeons with you to look after doing a DSC scan and everything, and you see that it is a neuroaneurysm and you can treat it. You can get expertised when you do more and more difficult cases and challenges are there in front of you. You are all the time having an emergency, you have a support system, so that actually builds up and your acumen of clinical knowledge. You get to have how to maintain the records, to write SOPs, to do a policy maker. So it's just not patient care, you have a health system, medical informatics, you have how to go into the population, public health. So it's a variety of collaborations and policy making which you can do. But at the end, you will be a professor who will be giving sitting over there and in the policy making system also. So professional development is there. You get a long-term, you get a period of leave where you can go and do your short-term, long-term training. You continue your skill training. You have a lot of collaborations, networking. You can do a lot of seminars, CMEs, conferences, teach your students, learn from them also. Advantage is a work-life balance, it can be done. You can have a time management, you have also productivity, you can make your resume good, you can go and have international collaborations, be a professor or a visiting professor, so you are gaining a lot of things, a less stressful life you are leading. But the disadvantage is you have a fixed salary, hierarchy is always there, infrastructure, some of the places are poor, you don't have the latest development, red tapeism, bureaucracy, political interference, and sometimes you have that comfort zone. So I just want to conclude saying that this hedgehog concept where you are passionate about doing something and you should know what is best for you and what drives the economy. So you have to find out your sweet spot. So to conclude, choose as per your temperament, contribute to the society, because at the end of the rat race, you will become a rat if you don't know what you are contributing to the society. With that, you become a good physician, surgeon, and a teacher, and a good human being. So I'll just conclude my talk with this quote: the only way to do great work is to love what you do. If you haven't found it, keep looking for it. Don't settle. Thank you.
Thank you. Thank you, Dr. SUCHETA. Whatever you said are almost similar to a private or a institutional practice, except that probably in addition you have responsibilities of administration and also policy making involvement. So good. I think that's also a good opportunity for youngsters to decide in joining a medical college.